Hi everyone and welcome back to another episode of GPnotebook TV. Lisa Devine is my name and I'm a GP in the Republic of Ireland. Today I'm discussing an article that was recently published in the BMJ in February 2024, which deals with the really hot topic of ultra-processed food. This article is called Ultra-Processed Food Exposure and Adverse Health Outcomes, Umbrella Review and Epidemiological Meta-Analysis. So we should start by looking at what an ultra-processed food is, I suppose. And interestingly, there isn't a very clear consensus on the definition of an ultra-processed food. But in general, we can say that these are foods which are composed of chemically modified substances extracted from foods and where there's a high incidence of additional additives being put in to enhance taste, change texture, appearance or durability of a product. Often they contain minimal to no inclusion of actual whole foods, and examples of these can be packaged snacks, carbonated soft drinks, instant noodles or ready-made meals. Concerningly, there is an increasing trend towards a higher inclusion of ultra-processed foods in many people's diets, especially in certain parts of the world. We're seeing this really being on the increase. So why are we worried about ultra-processed foods? What's the problem with just putting your microwave meal in the microwave and having the rest of your evening to do whatever you want? Well, I suppose these foods have had significant alterations made to their food matrices and textures, and they often contain a lot of additives which we're quite concerned about. Some of them have raised concerns about carcinogenesis. Also, these foods often have very poor nutrient profiles, so they tend to have higher energy levels, salt and sugar, higher levels of saturated fat, and lower levels of dietary fibre, micronutrients and vitamins. In addition to this, the high level of processing that's involved in the foods leads to concerns about contaminants from packaging material within the food themselves. The mechanisms by which ultra-processed foods can actually cause us harm are being studied at the moment, but there certainly are some plausible mechanisms being looked at. And it certainly seems that these ultra-processed foods can alter the gut microbiome and promote inflammation within the body. So what do the authors do? Well, they sought to look at epidemiological studies, large epidemiological studies, so mostly meta-analyses, and distill the findings down on these meta-analyses down to see could they give us some clear recommendations on where the evidence is at the moment. So they were looking at these large data sources, so mostly meta-analyses, and they were looking for any meta-analyses that looked at ultra-processed food and adverse healthcare outcomes, and they looked at studies from 2009 to 2023, and they really looked at a lot of different healthcare outcomes. So they were looking for data collected on all-cause mortality, cardiovascular disease, cancer, mental health related outcomes, respiratory, GI outcomes. So they really cast the net very wide to see what do we know so far about these ultra-processed foods. So they found a large amount of data to distill down. In fact, they found 45 large data sources. And as we said, they really cast the net wide to look at different healthcare outcomes. The evidence from the various studies, well, it did vary. And one of the problems of studying ultra-processed food is, well, you couldn't really do a randomized control trial where you put one group onto a healthy diet and one group onto an ultra-processed diet. It just wouldn't be ethical to do that. So they were reliant on looking at more observational sources. So they did find that there seemed to be a strong link between ultra-processed food and adverse healthcare outcomes. The strongest evidence linked ultra-processed food with all-cause mortality. There was also strong evidence to suggest a link between ultra-processed food and cardiovascular mortality. There was a strong link between ultra-processed food and common mental health conditions. And as you might expect, there was a strong link between people living with overweight and obesity and the intake of ultra-processed food, and a strong link between people living with type 2 diabetes and intake of ultra-processed food. The evidence was certainly, there was some evidence, although it was of lower strength and harder to interpret, looking at the link between ultra-processed food and other conditions such as asthma, GI health, certain cancers, and other cardiometabolic risk factors. So I suppose there were some links picked up there, but the strength of the links made it really hard to interpret. So these are areas where, where I suppose with time, hopefully we'll get more observational data. I think certainly this umbrella review gives us a good idea of where we're at the moment. So certainly it strengthens, the growing concerns about ultra-processed food and the effect that it's having on our health. It is really positive to see that certain health care organisations and governments have woken up to the threat of ultra-processed food. So organisations such as the American Heart Association have cautiously advised people to try to minimise the amount of ultra-processed food that they are consuming in their diet and go for foods that contain a higher proportion of whole foods. And many countries are starting to adopt public health measures, including sugar taxes, bans on marketing, avoidance of ultra-processed food in school environments, looking at warnings on the labelling of food as well, to make people more aware of the downsides of these food, and also try to, I suppose, control a little bit the proportion of the of the diet in different countries that is made up of ultra-processed food. I suppose this article for me confirmed a few of the concerns that I had about ultra-processed food, but also underlines that the evidence is really mixed, and it's an area where we need to have more study. So I hope you enjoyed this short video, and I hope you find it helpful, and I look forward to seeing you again on GPnotebook TV.